Hi, I'm Derek Spratt. I live in Vancouver, Canada. I'm 50 years old, and I'm shooting this video so I can share with you my experiences having a minimally invasive lumbar fusion. My back was fused 2 weeks ago today at Vancouver General Hospital by Dr. Marcel Dvorak and his team, an amazing guy. He fused my L4-L5, my L5-S1, so a double fusion right at the base of my spine. My son Colin here, 17 years old as of last week. He is my videographer. So I'm going to show you what my back looked like beforehand. So Colin, if you can zoom in here. Here's my spine, and at the very base here is the sacrum, and this is the joint L5-S1 here, and this is L4-L5. You can see at L3-L4 a healthy disc. This is an MRI image, and the white is really a lot of water in the disc. It's plump and it's got lots of disc height. And as you move down, you can see I have two collapsed discs here, and there's actually been bone on bone at the back here. And this started many years ago. This is probably 25 years in the making. I'm going to show you my facet joints. The facet joints are actually back here on the side view, but I'm going to show you a vertical slice through the discs to show you that my facets down here at L5-S1, you can see how they're misshapen and they're badly deformed. This is a technical term called I think it's concomital or concomital, where the actual degradation of the spine occurs basically at the facets as well as at the discs. I never had pain, sciatic pain running down my legs. I always had discogenic pain. The theory is that when I was 17 years old, I was doing a weightlifting maneuver, a clean and jerk, and after I put this weight above my head, my rear leg slipped and I hyperextended my back. I clearly remember at 17 years of age hyperextending my back and having like someone feel like they shot me in the back. It was incredibly painful. And it does look like my facet joints packed it in, causing disc instability. So I, over the last 30 years, must have torn my back hundreds of times. And each time my back got looser, each time my back got more degraded. And eventually the disc height narrowed until I was bone on bone. And then the body really struggles to try to keep my spine stable, and it grew a lot of additional bone. So we went in last Friday with this minimally invasive procedure. You can see my back here. This is the scar tissue, and it's basically about 3.5 inch long scars, 2 of them running on each side of my spine, and they managed to get in there, cut my facet joints out because they were shot. Then they went in and they actually cleaned up all the excess bone growth that had occurred around the back of my spine. Then they cut open the nucleus of the disc. They wedged it open because it had collapsed, so they increased the space. They then cleaned out the nucleus of the disc. They then took my bone, my morselized bone, that they'd harvested from my facets and from the back of the spine, the new bone growth, and they added human growth hormone to that, and then they put that into the spacer, the ceramic spacers. They then pushed those ceramic spacers into between the discs and bringing my disc height back. So here's an image from the side profile. The spacers are here and the spacers are here, and then they've packed additional bone around those spacers as well as inside the spacers, and then they drilled and they put in the screws, and then they put the rods in to stabilize it, and then finally before they sewed me back up, they put the morselized bone around the rods and the ends of the screws, and then they finished sewing me up. And instead of using staples, they basically used hidden sutures. One last view, Colin, here. This is a sort of a rear view. This is showing the screws from the back of the spine, so you can sort of see how they run at an angle. Anyway, the surgery was highly successful. I don't know how many of you are thinking about the surgery, but I encourage you, if you've got a good surgeon that is using a modern, minimally invasive technique, that you can be back on your feet pretty quickly. I was in the hospital 3 days. I was up walking the day after surgery, and I was discharged on the really less than 3 days out. And you know, it's the usual. I was on hydromorphine, which is a very strong synthetic painkiller, but I managed to get off of it in less than 2 weeks. Matter of fact, by the time I got home, I was at 1 milligram every 4 hours, and they had started me at the hospital at 4 milligrams every 2.5 hours. which is sort of the upper end of the dosage level. So I got off that pretty quickly because you develop constipation. So they get you on stool softeners, and then if you want to have a bowel movement, you've got to use a laxative. Sounds ugly, but you don't have the motility in your gastrointestinal tract with these drugs. These drugs slow your breathing. They do a wonderful job of calming your nervous system. And I just want to make a point that it's not just about pain management. It's not just about taking these drugs so that you don't feel the pain. It's about letting your body calm down and not overreact. And so I encourage people to probably run their opiates, their pain medications, whether it's oxy or whether it's hydromorphine or whatever they're going to give you, to keep using that for probably 2 weeks. Taper, 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 never cold turkey, because you'll get a bit of a reaction coming off of it. You'll get the shakes, and you won't feel very good. You feel like you got a bad cold when you're coming off those things. So taper down, take a little less each day, spread the time out between the doses. And one other thing you can do to avoid real discomfort after the surgery is to use an electrical stim unit. Physiotherapists often use these things. It's called a TENS, T-E-N-S. And you can put the pads on either side of your wound, and you can crank up the voltage just to the point where you can feel the buzzing, that sort of the electrical energy. That will help, as an analgesic effect, reduce some of the pain at the surface of the wound. And the other thing that I highly recommend is that you use ice packs, and you actually take the inflammation down by applying ice packs several times a day for about 10 minutes. And then finally, I was getting some sciatica. A lot of people on YouTube will complain that they get a little bit of referred pain week 2 or week 3 after the surgery. I was one of these people that woke up earlier this week and started to get some pain down in my left calf and in my toes. And I found that going for slow, long walks, and I mean slow as in half of your regular pace pre-surgery, go for these walks, go slowly. I have a little cane that I have that keeps me stable. Watch where you're walking, don't trip on things, don't trip on curbs, it'll be a disaster if you fall. But get out there and walk, and keep those nerve roots and keep the muscles moving. Avoid hills, avoid too many stairs, because that really puts a lot of pressure on your back, because it tightens your glutes pull on your back and you'll feel it. But just by walking, you keep your nerve roots, you keep your spine, you keep things moving. And I think a lot of the sciatica we get is not just the inflammation from the surgery, pressing on the nerves, but it's also the fact that the nerve roots themselves can get a little bit stuck after surgery, and then you end up with the inflammation plus the nerve roots sticking and causing the sciatica. So I'm 2 weeks out. I actually did go back to work 1 week after. My strategy was basically like 1 hour the first day, and then I ended up having a couch that I could lie on that was a good firm couch. And so I spent half days this week at work, and everyone says I'm way ahead of the curve. I'm doing much better than people expected me to. I actually am off the all pain meds now, and I'm feeling great. And I just want to have this video on YouTube to let people know that you can have a good positive result. Spent years not being able to sit in a chair, years with discogenic pain, not sciatica but discogenic pain, really bad pain, my spine often popping out of alignment and causing me to have terrible inflammation episodes. And I never ended up with the kind of pain post-surgery that I'd had actually in some of those prior inflammation episodes. So even though I was in a lot of discomfort and pain after the surgery, as you would after major surgery, I never actually reached those levels of pain that I had in the inflammation episodes previously. And now I'm at a point where I'm not entirely pain-free, because you won't be entirely pain-free for probably up to 6 months, but you will just be low levels of discomfort. And taking it slow, taking every day as she comes, realizing that your first week is going to be a bit of a crappy week. But distract yourself with visits from friends, distract yourself with other things, and try to be active, try to move. Anyway, thank you very much. Thanks to my son for helping me film this, and I hope this helps other people have the confidence that with a good surgeon, with the minimally invasive technique, you can get an excellent result. Obviously, I'm only 2 weeks out, but I'm definitely trending in the right direction, and I am looking forward to having better spine health and better confidence about my ability to do sports and to do various physical activities than I've been able to do in many, many years. Okay, thank you.